It is training time at the Mandal Upper Primary School in Amalapuram, a small coastal hamlet on Andhra Pradesh's eastern seaboard. Motley groups of children are scattered here and there, fashioning toys with whatever is available to them. On cue, the children enact what they would do if a cyclone were to strike. Ramappa is demonstrating mouth-to-mouth resuscitation on his friend, who has played a drowning victim. First aid drills and rescue operations are part of what the children learn in their disaster preparedness training. The children of today will be the citizens of tomorrow. It is with this belief that the children of Andhra Pradesh are being included in the community-based disaster preparedness program funded by Oxfam UK and implemented by a collective of local NGOs. The program began soon after the devastating 1996 cyclone, with relief works in the affected region. Oxfam started work in 60 villages through 4 local NGOs. Subsequently, Oxfam spread to 130 villages through 6 local NGOs, and then expanded to 250 villages through 24 NGOs covering 9 coastal districts. Andhra Pradesh has a coastline of over 1,000 kilometers with several hundred fishing communities, as well as major and minor ports across its seaboard. The region has a population of over 7 million people, and 22% of them are below the poverty line. The entire region is extremely vulnerable, and over 100 medium to major cyclones and floods have hit the region in the last few decades. 2 devastating cyclones hit coastal Andhra in 1996 and 97, when gigantic tidal waves flattened hundreds of villages and killed thousands of people. The total loss, according to conservative estimates, was over 6,000 crore rupees. An entire generation is still recovering from the trauma of the tragedy. Over the years, if there is one lesson that has emerged in the global experience in providing disaster relief, it is this: the interval between the disaster and humanitarian response is crucial. Outside agencies are not always the best equipped to deal with emerging crises, and communities have to be prepared to fend for themselves. As part of the strategy to reduce the time gap between disaster and the response, the community gets together to develop a contingency plan for disaster management, wherein they detail out what exactly each person will do in the event of a cyclone. Together, they prepare an area map that identifies the vulnerable areas and families, discuss the contingency plans, and form action groups. Along with the especially vulnerable population, they also record assets and infrastructure, including vehicles and boats, food stores, power installations, cyclone shelters, etc. Anything that might come in handy when there is an emergency. Another important aspect of this planning is the formation of village-level task force groups. The community forms a number of such groups that comprise selected and trained members from within the community who manage pre, during, and post-disaster activities. As part of the family-level preparedness program, at least one person from each family is educated on first aid methods, cyclone warning systems, practice of evacuation, and other relief and safety measures. An important element in the strategy of disaster preparedness is the building of a strong network of volunteers. This is being done through the horizontal training approach, where task force members have initiated other villagers. This helps them develop their skills to help others and also develop a stronger volunteer force in the event of an emergency. The combination of natural hazard and vulnerability translates into a disaster. Contingency planning can help communities manage disasters where they strike, but the key to disaster risk reduction lies in addressing the disaster vulnerability of the community. Some key areas to be addressed to reduce disaster-based risks include housing, insurance, income generation, health awareness and education. The houses that people inhabit need to be strong enough to sustain the impact of natural hazards. Designing and training for disaster-proof housing, helping people to access government housing schemes, and establishing community-managed building centers that produce safe building material helps reduce people's vulnerability to natural hazards. Low-cost technologies developed by specialized agencies have been utilized to aid the construction of more than 1,000 cyclone-proof houses that not only protect the community from the onslaught of cyclones, but also help them live more comfortably. Insurance can help reduce the impact of a disaster by restoring lives back to normal faster. A major obstacle in promoting insurance is a lack of awareness about the insurance policies. Insurance companies also do not seem to find it lucrative to invest efforts in motivating communities to buy insurance policies. The community-based disaster preparedness program action groups bridged this gap by mediating between poor families and insurance agencies. Insurance of assets and lives of the vulnerable communities was a unique achievement of the program. Many have insured, and there have been quite a few successful claims. A durable solution for reducing vulnerability is to increase people's income levels and savings, resulting in safer options and overcoming difficult periods. At the village level, income generation opportunities such as access to coconut fiber machines, hand-loom machines, training in making prawn pickles and its marketing, practical skills such as boat making, and the formation of thrift groups and cooperatives help in reducing the hold of money lenders and enhancing people's resilience to disasters. Better health helps cope with difficult times. Small clinics, mobile health centers, health camps, vaccination programs, and awareness on basic health and safer living conditions, chlorinated water, improved toilets, and drainage facilities are crucial for reducing people's vulnerability to natural hazards and are all part of Oxfam GB's Disaster Preparedness Program. Disaster preparedness cannot be a time-bound effort and should become a culture and a conscious practice. For this, it is important to involve different stakeholders and include disaster preparedness in development debates and processes. Oxfam GB has been engaging with government and non-governmental agencies to mainstream disaster preparedness in development processes. Workshops and trainings were organized for hundreds of media persons on the role of media in disaster preparedness and on the essentials in disaster communication. Today, Oxfam GB can look back to successes in creating proactive communities that rely less on relief and more on their own capacity. With the realization that shared information goes much further, Oxfam GB has made efforts to mainstream disaster preparedness amongst communities, NGOs, government and the media. The learning in this process is shared by participating communities, partner NGOs and many others. In the years to come, Oxfam looks forward to creating a future batch of communities with an inherent culture of disaster preparedness.